Hi, I'm Dana Burnett. I did my book review on The Cost of Cutting by Paul Ruggieri. Gives you kind of a behind the scenes look of what it's like financially for a surgeon. The cost from your very first visit to see the surgeon to decide if you're having surgery all the way up to discharge from the hospital. So there's some interesting facts. The first one that I found extremely interesting was that surgeries can range anywhere in price depending on if it's done in the hospital, an outpatient surgery center, the physician that works for the hospital, physician that's not working for the hospital but is able to do surgeries in that one. So examples: hysterectomy anywhere from $3,500 to $65,000, gallbladder $2,700 to $36,000, and a routine colonoscopy anywhere from $350 to $5,800. So he kind of goes through the discussion of how on earth do we have these huge ranges in pricing for these surgeries? Who makes these prices? What do they entail in your hospital bill? Because then you're also going to get a bill from your surgeon, from your anesthesiologist, and then how to break all of that down. I believe I read that it was $55 for somebody to have 5 minutes of oxygen before anesthesia. The longer you're in the recovery room, the more your price goes up. Operating recovery room, usually charged by the minute. So if you have some complications that were caused by anyone other than you, you're still going to pay for that. Another one I read was the surgical stapler. It's open, and if the surgeon decides to do your suturing and not stapling, you still pay for that stapler, or they drop it on the floor, or it malfunctions and they have to use another one. You as the patient pays for that. I found that to be kind of crazy, but that's how the hospital world works. Let's see. As working in the ER, I have patients ask all the time, how much does this IV cost? How much does that medication cost? Is it cheaper if I get it and take it by mouth, or if I let you push it in my IV for an IV medication? I honestly don't know the answers. I've never in 10 years seen the breakdown of what it costs to have any of this stuff done in the emergency department, nor do I know if it's the same at one emergency department versus another. So these are just some interesting facts that now I have stored in the back of my mind that I should probably pay some attention to and help with cost saving, and speak with other coworkers about when we open things and don't use them, or anything in your charting, you need to make sure you're not saying anything that could lead people to think that, the coders to think that you used something that you didn't, so the patients don't get unnecessary charges. I did enjoy in this book all the different areas he talked about, like having the manufacturers, like sales reps for the instruments, are actually in the operating room. Why? Do you get to say that they can be in there? Do you not? I don't know. I've never had anyone tell me that they would be in there for a surgery. In this book, it was nice that throughout the book, he would start each chapter off with kind of a backstory of a patient that he had had. So you kind of get the story of how it's all put together, even if you are not somebody that's in that area of the medical field. So this also leads me to think about all the things we do in the ER as like rushing to get things done, because everything's done by a time. Are you getting what you pay for, or are we doing things as fast as humanly possible to get more patients in and out? So that's something we need to consider. See our patients for who our patients are, not just trying to get people in and out as fast as humanly possible. See them as the patient. So Paul talks about that a lot in the book, is he sees his patients as patients, not as the money, which I really enjoyed. It kind of tied things back into the kind of work that I do. So I enjoyed this book quite a bit. I have recommended it to multiple coworkers just to kind of get an insight into things that we don't normally think or talk about in the medical field. So I enjoyed this book. I would recommend it.